Review Council for the Pfizer data. We were stunned, Alex, when the FDA asked the federal judge to delay the release until 2076. Over 50 years from now. I can't.
Now, you're a record skip at that point. Say that again, because the people thought this was a joke. This is real. It's now confirmed. They have asked the federal court to wait 55 years.
55 years. In fact, they've even extended it to 70 years to actually see what's going on with the vaccines. You can't make this up. The fact pattern is established. That basically, Pfizer and the FDA have told Americans there is no transparency here. Remember, transparency is a tenet of regulatory science. Now there's no transparency on a biologic product that we've just reviewed for America on safety. Remember, we do that. We're just as medical grand rounds, Alex. We review safety before efficacy.
Explain what that means for people that don't have a medical degree.
Our general principle is, above all, do no harm. I don't care how good a product is. If it's not safe, it doesn't move forward. I don't care how much you like your new car, Alex. If it's not safe, it doesn't get driven off the lot. It's very important. Safety comes first for all consumer products. And so importantly, with drugs and vaccines, we do a medical grand rounds. What our government actually should be doing for America every month, we should have a review every month on safety and efficacy. We're now a year into the vaccine program. There's been no review. So you can imagine when I go out and give a public program, there are thousands of people coming, and I am just giving Americans the straight data on the vaccines.
And again, that was pre-designed where they set it up where there wouldn't be the reviews and all this. I mean, I think it's overwhelming evidence that this is a depopulation weapon. That's what Dr. Michael Yeadon, the former head chief scientist at Pfizer, is saying. That's what a lot of other folks are saying. If you just extrapolate out, why are they doing this? And it's attacking the ovaries, and it's attacking young people and everybody and old people. I mean, what is the motive here?
No one knows. Clearly, the books are out there that are starting to, again, establish the fact pattern. This is probably one of the absolutely the biggest things in human history an investigative reporter could hotly pursue. As a doctor, I am simply just trying to grapple with the science.
I think that's what you said is important. This is probably the biggest event in history so far in human activity, when all the dust settles and you're just going with the science. You're letting others politically look at what's happening. But the fact pattern and the consensus across the board now of intelligence agency heads and top scientists and virologists and this is deliberate depopulation. When you look at it all, and now they're still covering it up and pushing it more, it's pretty clear.
Well, I tell you, it seems relatively clear that the best way to stay healthy is to stay free of any of these injections. Let's see what happens in terms of efficacy. People have asked me, Dr. McCullough, I took the vaccines. I was told I should do this. I knew it was patriotic. My doctors told me to take the vaccines. The presidents, we've had 2 presidents to say take the vaccines. Is there any benefit to the vaccines? Let's move to the 1040 paper from the Ivy Network. Look at the number of authors on this paper. This is the U.S. National Institutes of Health and the best and the brightest academics who work in clinical trials on vaccines telling you the data. The title of the paper is The Association Between Messenger RNA Vaccination and COVID-19 Hospitalization and Disease Severity. Let me tell you that in this paper, they had 45% of the cases had Delta. It means 55% were pre-Delta, so these data always run in arrears. And the vaccines, of those who took the vaccines, it was associated with a reduced risk of hospitalization. Now, because of differential testing, that means when someone comes in the hospital and they're vaccinated, they actually don't get a COVID test unless they suspect COVID. But if you're unvaccinated, they get a test for no matter what medical condition I have. Differential testing exaggerates the effect size for hospitalization risk reduction. It's clear. But having said that, I will tell you as a scientist that the vaccines were associated with some reduction in hospitalization. But people say, listen, I didn't take the vaccine and I'm willing to be hospitalized provided I survive. So let's look at the data. As shown here, in figure 3, one can see that in this figure, those patients in this table, in fact, had COVID-19 and they were being monitored for progression. And you can see here that the adjusted hazard ratio for progression of disease was 0.41. That's interpreted as a 59% reduction in the progression of severe COVID-19 in favor of the vaccine. So the vaccines, in fact, did provide some protection. But I highlighted the bottom line, House. The bottom line is, do you survive or do you die? And is there any impact to the vaccine? Here are the data. Death occurred in 9 of 142 fully vaccinated people who are hospitalized with COVID, and that percentage is 6.3%. And that's compared to 91 deaths out of 1055 unvaccinated for a percentage of 8.6%. And the p-value was 0.36, meaning it's not statistically significant. There is numerically a reduction in mortality with the vaccines. It was not statistically significant, but people have, you listen to Rachel Maddow, you listen to others, like the vaccine is a shield. You know, President Biden basically says, take the vaccine, otherwise it's going to be a long, dark winter. Well, I'm telling you, these people took the vaccine and they had a mortality rate of 6.3% in the hospital.
And I mean, Doc, what about all the studies I see? Because I'm just doing a boil down of my own mind, where within 3 to 6 months, though, it's somehow turning off your immune system or reducing it. So it works a little bit up front, like a therapeutic, but then it actually has a negative hangover.
Remember, the vaccines are giving our immune system a lot of work to do. We now know this is an install of spike protein for over a year. You can imagine how the immune system is changing, trying to clear out this foreign protein from the human body, from critical organs such as the brain, the heart.
And is that why we're seeing such studies of increase of cancers after? Because your immune system is basically exhausted, and they run a marathon, and then now it doesn't tackle the cancer, it doesn't tackle the next virus?
No, I think it's too soon. I mean, 2 shots, I don't think is going to be enough a quantity. Or
you said that 6 months ago. You said, look out for the third, and now so many people having the heart attacks and dying. Young people, old people, you name it. It's the third shot or the booster.
Well,